My name is Meg Powers and this is task 13, passing an orogastric tube. So what you're going to do is when you select your tube, you're going to want it to be about 1.5 times what you would normally pick for your trachea tube. And that's just so that way you don't accidentally intubate the patient. You want to make sure that you're going down the esophagus and into the stomach. So for our display, we're going to just do this tube only because it's a little bit shorter, but normally we would use a larger tube for a dog this size. So our assistant here is holding our patient in just standing position. What you're going to want to do is just measure your tube from the last rib to the canine tooth. And then we're just going to mark it with some tape. So we'll know that is where we want it to go in our speculum. All right, so what you would do is you would take this here. She's a larger dog, so we'd use a 2-inch roll of tape, but for a smaller dog, you could use 1 inch. You're just gonna open their mouths and place this behind the canine teeth, right there. So for our display, we're gonna have our restrainer hold it next to our dog for our simulation. So then you wanna take your sterile lubricant and just put that on the end of your tube. Then you pass it through the speculum, down into the stomach. And this is where her canine tooth is. There you go. All right, so the first thing you're going to do after you place your tube is just take some sterile saline, and you're going to want to put that down first. So the reason you want to start with the sterile saline is because if you were to accidentally go into the trachea and be in the lungs, your patient would start to cough, and then you would know that you had intubated incorrectly, passed your tube incorrectly. So because there was no coughing, the next thing we're going to do is take our medication, which for this we just dyed some tap water. You're going to put that down. And then after you administer any kind of medications, you just want to make sure that you're flushing with some water as well, just in case anything were to be stuck in the tube. Then after you do that, you're going to want to kink it and then remove it from your patient. And that's it.